My name is Jeanette Esquivel, and this is my fertility story. It begins back in 2018, the very beginning of the year, when my husband and I decided that it was time to start building our family. We had been married for 4 years at this point, and before then, we were the couple that did it all. We were able to travel, we were able to do so much with friends and just really be on our own. And it was time. It was time to create something of our own, to build a family. We were so excited, but we knew that it could possibly take some time, so we wanted to just be free with it. So 2018 was that year where we were like, let's see what happens, let's just go with the flow. And then towards the end of the year, I was like, this is weird, like nothing has happened yet. What's going on? And I thought, and I convinced myself that perhaps we weren't tracking, we weren't doing these things, right? So let's do that. Let's start tracking. So going into 2019, we were ready, we were tracking, we were doing all the things, ovulation test, having an app to track it all. And in September of 2019, I became pregnant. And we were so excited. We had just come back from vacation, and it was a really beautiful moment to experience together. And we went from the most elated, happy, grateful feeling to the worst possible feeling and the lowest of lows that I had experienced in a while. Because almost as quickly as we found out that I was pregnant, I miscarried. And that is its own story in and of itself. I was at work and I had not told anybody at work yet, but I was working late on a project, and going to the restroom is when I first noticed that I was bleeding. And I thought, this is normal, right? Like sometimes women bleed all throughout their pregnancy, and that's okay. Perhaps that's what's happening. And as the time went on, I realized that this was maybe a little too much. And I called my husband and I was just crying. And I remember just blankly staring at my screen at work and thinking like, okay, just get through this project and then you can deal with this when you go home. And then I'd go through phases of being in deep, deep sorrow and just really anxious and nervous. Like, what if this is it? What if this baby doesn't happen? And it was just the worst fear that I could feel. And driving home, I knew that the doctor's office wasn't open, but the next day I was able to go get some tests done. And if you've ever been through a miscarriage, you know that they test your levels of the pregnancy hormone to see if it declines over a period of 24 hours, I believe. I can't even remember at this point, but the numbers were consistent with that of a miscarriage. And as I continued to bleed for a couple of weeks, I just felt complete shame and guilt, thinking, what did I do? What was it that I did that caused this? And you can read all the things in the world that say, it isn't your fault, as the mother, it's not your fault that, you had a miscarriage. And we tell ourselves that, and it's absolutely the truth, right? And there was this part, and I can speak for myself, there was this part in me that was like, what did I do? And I just remember the pain, the utter loneliness, the depression that ensued from there for months. Yes, I was able to put on a face with friends and family and feel like, okay, it's just a couple of hours of doing this thing or this other thing or meeting up with friends. And then I would go home and my husband would see this shell of a woman, you know, this person that was so happy just a little bit ago, you know, and then all of a sudden not. And I began to question so much, like, you know, I knew I wanted a baby before, and now it was like this desperation, like this had to happen, right? Because I almost felt like in a way it had to complete me. And there was a couple of things happening there. That miscarriage was setting me up for grander and bigger things in 2020. When we went to get tested, I had been tested before, just my hormone, my blood levels, which all appeared to be normal. And then in 2020, they weren't. So my AMH hormone was low. And then they did the saline test to see if my fallopian tubes were open, which we found out that one of them was closed and potentially consistent with having endometriosis, which was also something that is hard to diagnose unless you have surgery. And I was not willing to do that because scar tissue. The more scar tissue you have in your pelvic area, the harder it can be to become pregnant as well. So that was something that I did not want to pursue, just to know that potentially, you know, that I have this diagnosis. But it made sense with the history that I've had of painful periods, which are not normal. You know, that's something that we all kind of bond over, right? As menstruating people, that periods can be painful and they're not normal. So that's something that, looking back, right, with these diagnoses, I'm like, should I have known? Like, what could I have known before? What didn't I piece together? You know, it was a lot of self-blame, a lot of guilt, all these things just piling up on me. And then we got approved for 6 medicated cycles, and that could be done through my doctor's office. So we went into it being positive, like, yes, this is going to happen. And because of the multiple factors that I had, which was the low AMH hormone and the blocked fallopian tube, I had to go into the doctor's office multiple times a month every cycle in order to do an ultrasound. So I would go in, they would do the ultrasound to see right around the time that I was going to be ovulating as I was taking these medications throughout the cycle. And they would see what side potentially I'm going to ovulate from. So if it was from the block side, then they wouldn't do anything else that month, because when you have a blocked fallopian tube, you can also have a higher chance of having an ectopic pregnancy, which, if you don't know what that is, an ectopic pregnancy means that the egg and the sperm have met and they've implanted in the fallopian tube, which is extremely dangerous. It can actually cause death in the person that is becoming pregnant. So that was something that the doctor's office absolutely did not want to do, did not want to put me at risk for. And it was really interesting because the first 5 cycles of the 6 were all, I was ovulating from the open side. And I was like, yes, this is gonna happen. You know, every single one, we were like so excited, like, this is the month. And then it wasn't. And along the way as well, we tried an IUI twice. So, you know, if IUI, if you know what that is, that's when they take the sperm and then put it into the, into me, right? To see around the time that I'd be ovulating. And then there's also injections involved to be able to stimulate the egg to leave the ovary. So all the whole thing. And by the end of the 5th cycle, I was finally, actually the 5th cycle, I was finally going to be ovulating from the block side. And I felt that in my body. I felt it because I knew that I just needed a break, right? And it was time to just take a pause because I had one more cycle left that was approved. And I knew that the next step after that would be a fertility treatment center where we would explore the possibility of IVF. And yeah, it was just around my birthday. And we just said, let's just take a break, let's see what happens. And we can always pick up from that 6th cycle a couple months later and just feel more aligned, more in my body again. And that's what we did. So I also had come out of that appointment when I found out that I was going to be ovulating from the block side. And I put on this podcast where it talked about, there's this company called Clear Passage, and it talked about how people can have adhesions in their body, and that can also be preventing implantation. So everything else can be working, meaning egg and sperm meet, but nothing happens, it doesn't implant. So when that's the case, there could be, especially with a history of endometriosis, and I've had a history of IBS as well, all these things can cause inflammation in your body, which can cause adhesions. So these adhesions come and they form in order for your body to heal in that area that's inflamed, or that you had surgery, or whatever the case is, right? So what happens is that area gets healed and the adhesions stay. And those adhesions basically cause your organs and everything else to kind of just stay in one place. There's no pliability, no like natural movement, I guess, of how your body is supposed to move, which can be constricting and prevent implantation. So I did this therapy. I actually went out of state to do this therapy with my husband for a week. They did 40 hours of this physiotherapy where they did manual manipulation of the outer pelvic area and did, just breaking up the adhesions. And then I also started with a fertility acupuncturist. And so this was July that I did that. I started with the acupuncturist in August, and by mid-September of 2020, we got a positive pregnancy test. So because of my experience, because of all of this that I have been through with my husband, and the ups and downs, the roller coaster, and being able to lean in to a community as well. I had been a part of a couple of boot camps that were basically coaching boot camps where I was a student, and we got to work through as students a lot of the baggage that we've carried into life so far. Not specific to fertility, however, I was able to work on a lot of the things that I felt were holding me back in one way or another. So through all of that, while I was going through my, physical fertility journey, I realized how important it is to be emotionally supported when you're on your fertility journey. That yes, we can talk about physical aspects of it, what to eat, what to do, how to do it, right? You can talk to your doctor, you can have all the things checked off your list from a physical standpoint, because we all know what needs to happen physically in order for your body to have a positive pregnancy, right? And there's so much about the emotional components that oftentimes gets overlooked. And the thing that I want to make really clear is that the emotional components of it all, I'm not in any way suggesting that that is what you need to do in order to get pregnant, right? That there's no one factor. There's every single person, every single case is different. I've actually met a person that had the exact same diagnoses as me, and our journeys are completely different, right? So everybody is different, and the support that we receive and we're open to is also a part of the journey. So with all of that said and done, when I got into my pregnancy phase of my journey, because I don't necessarily consider myself removed from a fertility journey. For all I know, I still have these diagnoses. There's still this thought in my head that if I want to have another child, will this be another set of obstacles that we get to go through, right? And I really think that there's so much to be said about just the emotional component of it all. The way that we function emotionally on this journey also has a lot to do with how we function in our lives up until that point. So my invitation to anyone that's on this journey is to lean in, see where in your on your path in your journey you can lean into the discomfort of it all. And yeah, for me, doing that, going through that process, and not and also continuing it while I was pregnant as well, because I, at that point, my pregnancy, was shorter than the time that I had gone through this infertility journey. And there was a lot of fear in my pregnancy as well, and a lot of me checking myself. So the whole part, that I want to stress is that having a community of people that you can lean into for support. So yes, you may have your partner, yes, you may have, your friends, but there's so much gold in having people that can hold you accountable, that can be that emotional support for you, that can totally understand what you're going through and what you're growing through, so that you can be that better person that you want to be on your journey. And personally, what I can attest to and what I can speak to is that now I can be grateful for this journey. And you might be thinking, yes, of course you're grateful you got pregnant and you had your baby. So perspective, right? And yeah, perhaps you're right. And I can also say that before I got pregnant, I got to a place of total gratitude for my journey, because if it wasn't for that miscarriage, if it wasn't for my infertility journey, if it wasn't for the struggles, the ups and downs that we faced, that I faced individually and that I faced with my husband, if it wasn't for all of that, I wouldn't be this person standing here today that's ready, that's willing, that is humbly here to help others and to be a part of something bigger than myself. Because what is the point of struggling, of going through things, if you're not going to give back? So that's my story. That's where I'm at today. And I thank you for taking the time to watch this video. I thank you for, just being open to receiving support and to giving support, because that's what it's all about. That's what we're on this life journey for, to be human together, to help each other. And yeah, I just hope that I get to support you in some way. And thank you so much for listening. I hope you have a wonderful day.